Welcome to today's technology policy discussion hosted by the Tony Blair Institute for Global Change. I'm Chris Yu. I run the Institute's work on technology and public policy. I'm delighted to have so many people with us to explore some of the issues related to how governments and policymakers can use tech to try to slow the spread of coronavirus and help countries respond to some of the impact. So just to frame this a little bit, I guess, we've been thinking a lot about the role that technology and public policy has to play in response to COVID-19. And in some of the work that we published last week, we really dug into the questions and the issues around how you use technology to try to get a handle on the spread of the virus. And the way that we talked about it was as follows: that the crisis really puts policymakers in a very difficult position. Your first option is to do nothing, in which case you very rapidly see health services overwhelmed and very unacceptable loss of life. The stance that many countries have switched to now is to impose physical distancing, and this comes at the cost of locking down your economy and your society, and this has tremendous costs in terms of both livelihoods, our communities, and potential other knock-on healthcare impacts as other procedures are delayed or made unavailable. And confronted with this choice, technology gives policymakers a third option, that you can try to ease the situation in, I think, 3 different ways. First of all, by thinking about testing and tracing to try to control and break the chain of transmission. The second is around adapting and innovating so that we're better able to cope with more people getting ill. And the third is around analyzing data in order to increase our situational awareness, which makes it easier for countries to build adaptive and responsive policy in response to a difficult and an unknown environment. But all of this, I think, comes at a really difficult cost, that if you're going to have more monitoring, more experimentation, more data sharing, then that potentially goes quite a long way further than what we would have been used to and comfortable with before the crisis. Nonetheless, compared to the alternatives, it looks potentially like the best way forward. And to my mind, the question isn't whether we should use technology to try to improve our capability to respond, but rather how we do so in a way which is competent, practical, and doesn't destroy the one shot that we have in terms of building trust with the public about deploying some of these measures. So in the work that we published last week, which you can find on our website, we set out some gold standards and guardrails that we think should help policymakers and guide them as they explore some of these topics. And we set out a series of recommendations for governments in terms of how they go about using technology to move the conversation forward. What we're going to do today is discuss some of these issues with a number of experts from around the world. It's a truly global event. I'm in Edinburgh. We've got folk in London, in Israel, in Arizona and beyond to join the conversation. And what we'll do is hear from each of them on some of the different perspectives of the debate and then throw it open a little bit wider. And we'll go through these topics that I mentioned in terms of the chain of transmission, these questions around innovation, and then broader issues around data sharing and policy. So to kick us off, I would love to bring in Tina White, who is Executive Director and co-founder at COVID Watch, which is an open source initiative around contact tracing and has been developing and thinking a lot about the issues to do with technology-enabled contact tracing and how we do this in a way which is effective, but also privacy protecting. So Tina, if we could start with you, maybe just tell us a little bit about your background and how you came to be working on this, and then maybe let's get into some of the questions, particularly I think to do with like centralization or decentralization seems to be a big kind of pivotal point in the debate. So maybe we should start there.
So I'm the Executive Director at COVID Watch, and we are the first team to publish a white paper on a decentralized privacy model for Bluetooth-based systems. So there are a few different ways that you could design Bluetooth. We're going to discuss about the difference between centralized and decentralized, and on our team, we think there's a very big difference. So we designed it to be decentralized because of the privacy implications that come along with centralized systems. And we got started because we were concerned seeing apps that were being developed in China and in just other countries that were designing apps that might not be as privacy focused as they could be. So we started thinking about what are the different methods for performing contact tracing, what are the different capabilities that most people's smartphones even have, what's the best way to do it that still maintains people's privacy as much as possible. And that's when we found, we ran into another team that had existed prior to COVID-19 to track the regular flu, like protect your friends from the regular flu using Bluetooth, share with each other. If you have it, people are less likely to get it in your community, and they had been thinking about building something like that, and realized that it applied very well to COVID-19, and they switched. And we were talking to them and realized that Bluetooth was a great option. And my collaborator at the University of so I'm from Stanford, and my collaborator at the University of Waterloo in Canada came up with this decentralized privacy model for a way to enable people who are using an app like this to only share that information with each other instead of having to do a central ID database. So there's a way to avoid that, and there's a way to avoid most of the surveillance implications. There's still the question of dealing with privacy perception, because you could still do it correctly, but people might not trust the system. So that's a separate question, but whether you actually do it correctly, there is a way to do that. We have the technology to do it, and that's what we're trying to advocate for. So we built the system. We open sourced an implementation so you can see exactly how it works. And we've been building a version of our own app, but also helping other apps to implement decentralized versions of this system, and hoping that this becomes the standard, because it's sort of unnecessary to implement the centralized version where you're tracking everybody and you know who's who and who's interacting. There's a way to do it where you don't have to collect that information. You don't have to collect any personal information. So we're excited about that, and we think there's a way to do it that could help a lot.
Fantastic. And for the people who are watching and trying to understand why some governments are still pressing on with a centralized solution, what is the argument in terms of the advantages you gain from centralization? Because my understanding is it helps you to understand the social graph effectively of how the infection is spreading.
So there are also good reasons to want a centralized system. And it isn't until we sort of explain that, okay, well, in order to enable this functionality that you want, you need to have a centralized database, and that's something that people will be concerned about. And then often people listen or understand that that's a trade-off. But generally, contact tracers and people in public health would want, or there's some amount of pressure from that side that they do want more information and more data to do research that are positive motivations as well. And so the question is more of this, how much do you lose in terms of maybe trust in the system and versus how much do you gain by getting all of this information. And we think that in this trade-off, you gain more by doing whatever gets you is actually something people would want. Yeah. So we're hoping to build something that is useful for people personally that they would want to have. To protect themselves, to help protect their friends, to have some amount of a little bit of personal power over the epidemic in some sense. Because if you share this information, this helps, and if everybody does it, it would stop the virus pretty quickly. Yeah. And if enough people, 60%, use it, then it would start to slow it down.
So the critical thing seems to be to get as many people as possible. But regardless of how you architect the app, you need as many people as possible to use it. And your argument would be, if you're able to do this in a way which people trust, you're far more likely to get to that 60% threshold.
I think so. And we were looking at some surveys that asked different questions about what are the things that people most want in an app. And I think around 60% of people wanted to be notified if they've had significant exposure. And it's something that people would want to know. And it's important not to build the system in such a way that it scares people off, or that it seems like it's coming from big tech and big government in a way that would prevent people from downloading something that they would otherwise want to use, or that would be helpful to them. So that's the way we're thinking of it.
Great. And one other question I had, just in terms of the technology, and an issue that I've been thinking about is, so you've talked about your protocol has been designed and opened up so that people can build interoperable services. Like, it strikes me this is going to be really important, because in a world where air travel is restored and people start to move around again, actually we're going to need a system that works across countries, right? Not just within them.
Yes, that's right. So you need to put some thought into interoperability, either to have one app that's used in a region, or multiple apps that have talked to each other and have basically built very similar backends that can easily share data across their services. So there's a few different ways to do it. There's sort of space for multiple kinds of apps too. I mean, maybe some will be more likely to have higher adoption than others, and maybe in that sense it's better for there to be multiple ones, and then we end up with the best option in the end. So there's the trade-off of, if they're not talking to each other and they're not interoperable, then that's in the long run not good. So as long as there can be multiple apps, as long as there are shared standards, and Google, Apple having an API from them helps in one sense, that it makes, most people are going to point at that now. So it helps to have that standard, but there's still a little bit more work to do to make sure that all of them are doing the same thing.
Okay, fantastic. Super interesting. I'm sure we'll return to some of these conversations in the Q&A in a second. What I'd like to do now is just explore another element of the technology policy debate, which is around this question of how quickly you can adapt and innovate, not just in terms of tracking and tracing, but also our ability to handle the additional pressure put on healthcare systems. And Dr. Eitan Eliram, who's with us from Israel, has been working on an open source ventilator project, which I think is super interesting. So it's low cost solution. You can tell us more about it in a second. I think designed to try to alleviate some of the pressure in a very practical and collaborative way. So maybe if you could just explain to the people on the line what you've been working on and why you thought it was so important to do this.
Sure, pleasure to do so. So I'm talking to you from Jerusalem, Israel. On my daily work, I'm running an innovation agency, which is sort of a private tech accelerator. And when the pandemic started, I was watching the news and I saw this little article about a major from our Air Force going to a hospital and giving the idea that if we will need Plan B for our country, God forbid, all the resuscitators will be exhausted in terms of corona patients, what will we do? And he put the idea that we can take the ambu bag that you can have in every ambulance. This is sort of an airbag that you squeeze and get some air. Maybe we can do something with it and help the patients who are waiting to be resuscitated with the high-end machines and keep them alive until things are changing. So he built a robotic arm that sort of squeezed the air out and in and out and so on. But then he started to add some electronics and some design and some algorithms into it. And together with the physician friends from one of our leading hospitals, in 10 days, with 60 people around him, I'm one of them, we had a new machine in the world. It's called AmboVent. Now, AmboVent is really a machine that you build and you pray that no one will ever need to use it. It's a Plan B machine. One of the reasons we were very fast to build it is a phone call we got from a friend, a physician from Italy, telling us that at some hospitals in Lombardia, in northern Italy, that's exactly the situation. Lots of patients are waiting to be resuscitated, but there's not enough machines for everybody. So they're spending the last hour of their lives while, in their smartphone with their families, sometimes online, and just dying, and there's nothing that the doctors can do. This is a really dire situation, extreme situation, and we were afraid in those days that this is going to happen in Israel. So we needed really to innovate fast. By the time we finished to build the machine, the curve of the exponential growth of patients started to come down. Things started to calm. And we decided that this is the right time for us to go and publish everything that we designed and built and coded on GitHub, which is a website for programmers, geeks, makers who come there to take code and share code. And we said, let's send the code to the world. Let the world have it for free, and maybe people can save themselves wherever they are. So 1 hour after we uploaded on April 1st to the GitHub, we recorded 19,000 downloads. Now, this is not a music or news website. This is a place where people come to get code. So we assumed some teams are now beginning to build the AmboVent anywhere in the world. We have a fairly good indication that 300 teams are doing it because they're all doing it with us. We opened WhatsApp groups for 40 countries, an international hive mind for AmboVent, and this is a community of practice helping one another. So we had to, after we did it, we started to understand that there is a logic to it. And here's the logic, I'll say it in brief. Corona itself, the virus, is not a living creature. It's a piece of data running by the air, transmitted by saliva, and its virality is high. So it's probably going to kill between 200 to maybe more, but on the hundreds of thousands of human lives. We are going to use digital networks to run faster than the corona to save the millions. So, for example, the emails that will be exchanged between researchers, even this Zoom call, the network, the digital network that we established between all those developers around the globe is faster now, and we're building about 300 units in each country. So this is sort of a way of thinking about open source code as running faster than the corona can kill.
Yeah, it's a really incredible story, I think, in terms of the power of technology to amplify an invention around the world. I wanted to ask just a bit more about, you said very clearly that it's very much a plan B, like a last resort when a country is out of the primary equipment. But I guess nonetheless, it carries risks, and in normal circumstances, we'd go through, potentially quite a long procedure of testing and regulation and validation. Do you think that, where did those concerns fit in your work? Did you have to have conversations with regulators and policymakers about whether you were even allowed to pursue this? And how did they respond?
Absolutely, yes. Well, first of all, I must say that from the very beginning, we had physicians from leading hospitals in Israel, helping us in designing the machine, trying to make it as safe as possible. So that was the initial element. But then when we came to the Corona National War Room in Israel to present the AmboVent, we saw there the regulator, and the disruption, the level of disruption we positioned to him was sort of, oh my God, what do I do with this machine? It's like in 10 days, and we have to incubate people with this. It's like, God forbid we need it, okay? Then after, drinking a cup of tea, we started to think about it. And we said, look, it's either that or nothing, okay? It's really a plan B machine. And then after, I think, about 2 weeks, when we assembled our global legal task force to help either get the FDA approval or the CE or the NIH in Britain or the Israeli regulator to authorize the machine, we understood that things are also changing for the better for the regulators. That means there's a societal pressure on the regulator not to stand in place with the regulation, with a regular one, And we started to see how they put COVID tracks, fast tracks, in order to help. So immediately we, of course, submitted our plans, our designs, and I think we're very close, like in days, to get the Israeli to approve our machine, and same goes for the American FDA. I'm saying it because I started to get phone calls from heads of states telling me, don't ever think that you guys are just geeks and makers who are making this little Lego machine. For us, you're national security. And I said, come on, guys, don't, what are you talking about? And they say, look, there's not enough respirators in the world. There's not enough breathing machines. There's a shortage in supply chain. There's not enough parts, even for the high-end machines. So if we don't start working with you, building this Plan B machine, we might be in a situation where we have nothing. So it's really a Plan B machine, but if the alternative is nothing, many people will die, which is now the situation in South America, Southeast Asia, and Africa. That's why we're in a rush.
Yeah.
I just want to add another element to here. We sort of needed a few dollars to improve our prototypes, maybe to upload another version to speed up things. And we needed some funding for that. We decided to take it totally on the philanthropic track. And we submitted a few PDFs to a few philanthropists. They told us it's going to take about a month, 2 months to come back to you. And we said, we don't have that. So immediately we went into the digital crowdfunding. So again, digital is faster and helping us move faster. So regulators, philanthropists, even our lives, everything is changing due to the corona.
It's an incredible, I think, glimpse into the speed at which things can happen on the internet versus the traditional structures. And I think it's a good point to just move into the conversation around data sharing and cooperation. And here, what I'd love is a perspective from Emily Sharpe, who is Director of Policy at the Web Foundation. I know that these questions of collaboration, of openness, of the power of the web to bring people together are really dear to your heart and to your organization. But there are obviously some, interesting and difficult challenges around marshalling some of this, new sources of data or combining them in ways that maybe we haven't previously. So Emily, maybe you could just say a bit about that perspective and how you view things.
Sure, absolutely. And thanks so much for having me on, Chris. So as you mentioned, I'm Director of Policy at the Web Foundation, which was founded by Sir Tim Berners-Lee, who of course was the inventor of the web 31 years ago now. And I think we can all recognize, and as you noted, Chris, this crisis indicates that the web and the internet is more important than ever. The web is a lifeline in the context of COVID. It's not a luxury. Everyone needs it. And I'm so encouraged to hear from Eitan and from Tina, because the work that you're doing very much reflects what Sir Tim has always believed in, which is the value of the web to promote open knowledge, open source, to come up with decentralized solutions. That's very much in the DNA of the web. So really, really encouraged to hear the work that you're doing. What we have done for our part at the Web Foundation is to publish a series of policy briefs reflecting on some of the biggest challenges that we see in the era of COVID-19. The data privacy brief is coming out shortly, so please look out for that. So far, we've published a brief on access and on misinformation. And our policy positions are also very much grounded in the Contract for the Web, which is a global plan of action to help guide companies, governments, and citizens to establish new norms for what the web that we want should be. Sir Tim launched the Contract for the Web last November. We're currently in the process of getting it up to speed, and certainly COVID highlights the importance of all of us coalescing around new norms on privacy, data collection, open source, open knowledge, et cetera. So to come to your question, Chris, on open knowledge and the importance of data, cooperation, et cetera, as other panelists have noted, and I won't rehearse in great detail, to slow down the spread of the coronavirus, we absolutely need access to accurate and timely data. We're all creating a wealth of information that can be used to understand how and where the virus is spreading and how we can tackle it. So we need innovative, but also responsible approaches to using this data to solve the public health crisis. And I want to underscore that we need all types of data. We need aggregated or anonymized data to create, for example, heat maps to help public authorities better understand population movements, like we saw from some private sector actors like Vodafone, Google, and Facebook. And as in many cases, as Tina and Chris have noted, we need personal data, personally identifying data to track and trace. Although, of course, as Tina noted, there are some ways to reduce privacy impact in collecting that and using that personal data. I also want to be clear that anonymized data is not subject to privacy frameworks like the GDPR, but we also know that it's exceedingly and increasingly difficult to truly anonymize data. Personal data and pseudonymized data is subject to frameworks like the GDPR, and so that's where the safeguards come into place. Privacy should always be at the forefront when data is collected and used, but I also want to address this idea of trade-offs. There may be some real trade-offs, but I also want to make sure that we're not creating a false dichotomy between privacy and health. Privacy and public health do not have to be at odds. Privacy laws and frameworks are by and large designed to allow for the use of data, which can be essential to public health and in the public interest. So I want to be clear, we're not, despite some reports in the media and some panic, we're not necessarily in completely uncharted territory, at least not in Europe and some other countries where there are comprehensive data protection frameworks. As the European Data Protection Board has recently said, and I think this is a very important takeaway, there is no reason in the context of COVID-19 to lift GDPR provisions. We need to apply them. And that is certainly, and I'll speak at the end about the importance of all countries having comprehensive data protection law, because I certainly recognize that not all countries are in that position. But for those such as the UK, of course, who had originally adopted the GDPR and will, I understand, continue to apply it in some respects, and certainly for EU member states, we do have the GDPR, and this is an instrument that was negotiated for many years. It was an evolution of the European Data Protection Directive, and there are numerous references to public interest legal bases to deal with crises like these. So data protection isn't about locking down data for all purposes, only to unlock it and set it free without any protection when there's an emergency. Data protection is about setting guidelines for the proper use of data according to the purpose and according to the surrounding circumstances. So for example, during normal times, commercial use of data will have certain types of safeguards that apply. We're in a different situation when it comes to health data. So there may be some specific time-limited purposes in the midst of a public health crisis where we have different types of safeguards in place. So I'll just wrap up briefly, Chris. In terms of the existing safeguards and frameworks to adapt to new uses of data and tech, there are a number of opinions that have been issued by data protection authorities globally. That includes the European Data Protection Board, certainly the Information Commissioner's Office here in the UK. I also note that the Australian government released a 78-page privacy impact assessment evaluating the privacy protections of its contact tracing app and how they are in line with Australian privacy principles. I admit I have not read all 78 pages, but I am impressed that they have gone through the process of putting it out. No matter where any one of us live, I think some important safeguards to note from a global perspective. Any data that's collected and used must be necessary and proportionate to fighting the virus and subject to oversight and accountability and grounded in law. Governments and companies providing data must operate transparently. They have to tell people clearly how their data will be collected and used. That very much goes to the points of trust that you raised at the outset, Chris. Only the data necessary for the job at hand should be collected. It shouldn't be used for any other purpose, for commercial or law enforcement purposes, for example. And the correct legal basis has to be used. So for example, the European Data Protection Board has noted that public authorities, where applicable law exists, could use the public interest legal basis to justify processing of data for contact tracing purposes. Where consent is the legal basis, it must be meaningful and valid consent. Yeah. And of course, wherever possible, data should be anonymized so specific individuals can't be re-identified. And then most importantly, these measures must be temporary. When the virus is under control, whenever that may be, specific measures are no longer effective for tackling it, then these types of data collection and use must end. So I'll stop there. I'm sure there are many other points that we can discuss, but those are some of the highlights I wanted to raise.
Thank you so much, Emily. And I think it's a really good reminder that we have a lot of frameworks in place that include public interest provisions for times like these. I guess one of the things that strikes me is that you may well be operating within those frameworks, and as you say, it's about applying them rather than disapplying them. Nevertheless, the lived experience may feel quite different for the public because there are new measures in place that we wouldn't have had previously. And I think this is a good point to bring in our last panelist, Darren Jones, who is MP for Bristol North West. Have I got that right? And also a member of the Commons Science and Technology Select Committee. So Darren's been thinking a lot about the topics that we've been discussing today. And I guess, what would fascinate me, Darren, is, your perspective as someone who's been interrogating the British government around this. And also, from the perspective of your constituents, how do we feel around, one might argue that a time of crisis is the time not to take any risks and to play it safe. Or you might argue that a time of crisis is exactly the time where we need to go further than normal. But I would love to hear your perspective on this.
Well, thanks, Chris, and it's great to be with all of you this afternoon. I come to this topic both as a tech evangelist, but also as a parliamentarian. And as you mentioned, Chris, as a parliamentarian, you have kind of two functions. You have the national function in Parliament, but also the constituency function in representing in the UK around 100,000 people. From the constituency angle, there are kind of two limbs of consideration. The first is, I think if I were to ask my constituents, as I will do on online coffee politics on Saturday morning on my Facebook page, what do you think about this? My constituents would probably say on the whole, well, look, if it means we can go back to work and the kids can go to school and we can open the shops again and I can start to, get back to normal, then we need to kind of crack on and do what we need to do. But equally, if in 6 months' time something's gone horribly wrong, they'll probably say to me, well, why didn't you ask questions about this at the time? This is, what your job is. And so that kind of then leads into this national question and the role of Parliament. And it's really important that when we're talking about concerns around privacy or trying to understand what's going to happen with data, we're not trying to block the use of technology in helping us to achieve our policy objectives, but it's an important and proper role for Parliament and for parliamentarians to ask questions of government, to take evidence and to try to understand this on behalf of the public, because as we know with mobile tracing apps, it needs a lot of people to download it and use it and for them to be effective. And so we kind of have this constitutional role in doing that work on their behalf. And as you say, Chris, I'm a member of the Science and Technology Select Committee, and we've been looking at this. And the questions for us, okay, you've got the legal frameworks that are already in place. There's some debate about whether you need additional legal frameworks to kind of limit the scope and use of these technologies for the particular period in time in which we are currently working. But a really important question for us, and we raised this on the committee this week, was about actually thinking through the scope. And that can be difficult sometimes when people are working around the clock to try and deal with a national crisis, to build effective solutions. They probably haven't had the time or opportunity to stop to think about, well, what does this actually mean in 6 months' time or 9 months' time? And this isn't just about how the mobile app works, a debate about Bluetooth or centralized servers and decentralized processing on devices, but it's also a question of, well, where does that data sit afterwards when the app is retired? Is it going into the national data dashboard, for example, that government's using to take broader decisions around response to the crisis? Who is that data being shared with? What can it be used for when the pandemic has been when it's ended? What happens actually if there's a big gap between first peak and second peak of infection rate and lockdown measures, and how does that all fit within those parameters? And so those are the types of questions that we're asking, and I have to say the answers haven't been particularly good so far. I get it's been difficult and been done at speed, but we're going to continue to probe those questions because we need people to think about them, and we need the answers where at all possible in public, and to be confident on behalf of our constituents, but also in terms of our parliamentary function in holding the executive to account, that this is being done in the right way right now in the pandemic, but also afterwards as well.
Yeah, I mean, it seems so important in terms of building public trust around the technologies that we're talking about. And I think, I can sort of see the incentive and, as you say, the kind of need to move at speed. But I feel like, not just in the UK, like a more grown-up discussion about how difficult this is and what we're trying to balance would be really beneficial.
Yeah, and how you have this conversation is important, right? Because, I asked, for example, Matthew Gold, who's the CEO of NHSX, the digital kind of innovation arm of the National Health Service. I said, I'd like to see the privacy policy, Matthew. And he said, I'm going to send it to you and I'm going to read it. But as we know, most people don't really read privacy policies, right? So it's about the tone of the debate, and Parliament and parliamentarians have an important role in that, because of course the media report on what we're saying. And so you don't want to create a situation in which people feel, whether they've read the privacy policy or not, unsure about their confidence in using this technology. And so how you have that conversation has to be in a positive and collaborative way, but really working together to get to the right outcome, so that equally you don't kind of put people off from using it because they've heard you say on the news that, I don't know, the data is going to be shared with whoever and used for law enforcement purposes or whatever it might be.
Yeah. Okay, thank you so much. So that's a kind of quick tour through some of the issues around the chain of transmission, around innovation, around data sharing, and around politics and trust. I think what we'll do now is try to take on some of the questions that are coming in from attendees. And I am going to attempt to let people put them in their own words. Simon Burrell, I'm going to come to you first. Your question is around the role of technology versus non-tech and social aspects of this, but you should be able to speak if you've got a microphone.
Thank you. Yes, I can. Hopefully you can hear me.
We can hear you.
Maybe see a lovely picture of me as well by the look of it. So yeah, so you took a decision to kind of focus on the kind of tech and the role of tech, and you said at the beginning that it's the best way to deal with the crisis. And I just wondered kind of on what basis you made that decision, because clearly, you know, if we think about digital exclusion, there are a significant proportion of the country who will be unable to use mobile phones, as one example. So I'm just wondering kind of what criteria you used, and whether there's any role for non-tech solutions, whether it be kind of, you know, paper contact tracing and so on. And there will be lots of other ways that you might do it.
Okay, look, I think it's a really great question, and let me kind of say a few words and then maybe ask other people if they want to come in. It seems to me that you're absolutely right that technology isn't the complete solution. I think where we came from in the work that we were doing was to try to tackle the question of the role that it can play. And I would say it gives you optionality in a very challenging circumstance. But as you say, it can't be the whole solution. Many of the things that we're talking about are by definition untested, and we don't know whether they will work. And as you say, there are serious issues around digital exclusion and people's capability to engage, which we have to look at. And so one of the things we talked about in the report was, you know, for some of the proposals that are out there on things like how you use digital methods to certify if somebody's been tested, for example, there's got to be an alternative for people who don't have a smartphone or don't choose to use one in that kind of way. I wonder, Darren, maybe you've got a view on this sort of the role that technology plays in supporting people and communities rather than just solving this stuff by techno-solutionism.
I mean, I think the pre-pandemic answer is the same answer to the pandemic answer, which is if you're trying to deliver public health or national health services to a large population in as efficient a way as possible, in a most cost-effective way with increasing demand, there has to be technology-enabled solutions, but equally there also has to be the human element in it, because there are some roles that can't be fulfilled by technology and some that could be assisted and some that might be delivered wholly. When it comes to the tracing issue, of course, it's just a question of capacity. I can't recall the complete number now, but we've had evidence on the select committee about how many human tracers we would need to deal with the entire population, and it was a very, very significant number. And that's why the conversation around the use of the app and kind of self tracing is an important part of capacity to be able to deliver those outcomes. The kind of non-digital tools though, so for example on the immunity certification issue, although that's a whole other debate that maybe we'll try to get at another time, you then also have to think about kind of verification and fraud issues as well, and inequality issues that come with that. And again, those are the types of questions that we don't really have proper answers for yet from the government or indeed from Parliament just yet.
Yeah, okay. Lorna, I'm going to come to you next. You've got a question about how COVID-19 is different, and I guess really it's the sort of slippery slope from contact tracing for COVID-19 through to other uses.
Thanks to the panel for their presentations. I suppose it is a slippery slope argument. I am concerned that we understand what is so pressing about COVID-19 that justifies perhaps relying on exceptions to protection. So we've talked about, you know, applying data protection or applying privacy laws. Essentially what we're doing is looking to rely on exceptions, especially when you've got apps that don't necessarily rely on consent. And so the concern is that, well, there's two ways. One is the idea that that Darren mentioned, that this data then gets used onwards for other projects that are equally, you know, threatening to public health or to the health of individuals. And then there's the question of, okay, well, we might have another pandemic, or we might even have a bad bout of the flu. So shouldn't we just keep these apps and tracing and databases going so we're in a better position to save the NHS or whichever body when that happens?
Yeah. Maybe, Tina, can we come to you first? Because, I mean, you even mentioned, I think, that, you know, some of your work was inspired by previous attempts to do this kind of exposure notification for seasonal influenza. Like, how do you think about whether this infrastructure like can ever be disassembled once we have it?
Right. I'd like to respond first to Lorna, your question. Some of the phrasing about them being tracking apps and trampling over people's rights. So we see a lot of responses like this when we talk about our app, and I think this is the correct response, because every app that I've seen out there has claimed to be privacy focused. There's not a single app that says it is not privacy focused, and yet many of them collect massive amounts of GPS data. Many of them are centralized Bluetooth apps that are collecting who's interacting with who all of the time, but promising, but we'll keep it secure. So the response of some amount of mistrust or assuming that these apps are going to trample on people's rights is the correct one. And there's some amount of, it's our responsibility to make the argument on our side for why a particular system is the one to implement in this epidemic. And so I think I wanted to address that first, so that we're doing the best that we can to explain our technology. And I think that one of the important points for the decentralized version is that it really does operate in a very different way. So we're not tracking or tracing anyone. We don't collect any data that we need to anonymize. All we're collecting is random numbers, and to some extent, and only numbers which are necessary to perform this kind of anonymous messaging system. So the apps that are using decentralized systems are a bit night and day with the ones that are not. So I think I wanted to bring that up first. And our concern from the beginning was about the apps that we were expecting to see that were doing tracing and tracking, and knowing that there's a way to do this without collecting anything in the first place that is personally identifiable that we need to anonymize. So we don't collect any information about anyone. We collect just numbers that are necessary to perform anonymous messaging later. If you do, if somebody does report positive, then you can alert the right person without knowing who that person is or who the message came from. So yeah, we're very excited about this particular system that we're using. It's very technical to explain it, and so we're doing our best to put it in, to explain it well, because I do think it's our responsibility to do that. And I think that that's one of our important roles, the apps that are doing this, to how it is to really differentiate it. And it's tough to do because we're in a space where every single app is claiming a privacy focus, and many of them were concerned about privacy, yet their models are very, very different. So, you know, talking about that, there is a very wide range here. And I'll answer your question that you just asked here too, which is, can this be applied to other epidemics? So this technology took a couple months to develop. We started the middle of February, and yet just now it's ready. So what if there was an epidemic that had moved faster? It could have been worse. So having this technology exist is a good thing, so that if there's something that happens again, another pandemic that maybe is worse or faster, at least something already exists that we have that we can point to that we've used before. And that's in some ways a good thing. However, having it on all the time when there's not a pandemic, I don't think people would, and I understand why not. So the numbers that we collect for the random for anonymous messages, our plan is to delete after 3 to 4 weeks. So it's not just, well, you turn this off after the epidemic. We already turn it off after a few weeks for everyone. So yeah, so our setup is to collect minimal data and to only collect what's needed to perform these anonymous messages, and to not collect the information about any particular person, to avoid that if we can.
Got it. And I guess this is one of these aspects where the decentralized approach is really interesting, because if people stop using it, then the infrastructure is no longer there, in a sense.
Yeah, if you delete it on your phone, it's just gone. And if you try to get the data back, we don't have it because we can't connect it to you. So there's no way.
Got it.
But it's very easy to delete. And it's not personal data in the first place that needs to be collected, I think, which is a very big difference between other systems that collect personal data and promise to secure it. It's a very different kind of system than one that doesn't do that from the start.
Yeah, got it. I'd like to bring Emily in a second. And before I do that, just to turn to Martin, because I think these questions are linked around medical data and collaboration. So Martin, just your point around epidemiological research and population data.
Okay, so that's the second question. A lot of the epidemiologists around the world are very interested right now in doing what they can in relation to COVID-19. A number of them already have access to large data sets from consented individuals in each of their countries. People will probably, well, the UK people on the call will know about UK Biobank, which is one of the biggest with 500,000 people in it. But there are similar large projects in Germany, Norway, France, United States, Canada, and so on. And China, of course, there's the biggest of all are in China, I should have mentioned that. Linking those data sets would really be invaluable, would be really, really useful. And efforts have been made by an organization called P3G, Public Population Projects in Genomics, which has been running, the organization has been running for 15 years or so, nearly 15 years. But there have been great difficulties in getting people to share data. It hasn't actually happened. Already the software exists for harmonizing the data between the different data sets, but it hasn't been implemented. I'm wondering if the Web Foundation could actually help in this and try and knock some heads together on the grounds of us needing it for COVID-19, but actually we need it for a whole pile of things.
It's a really good question, isn't it, around where it is in the kind of, we need to respect people's privacy and the role of consent, but there are some of these global challenges where we have to come together to solve them. So Emily, your thoughts around this and the kind of broader questions to do with data and people's perspectives would be great.
Sure, happy to weigh in. I'll answer the question that I hope captures both the issues that Martin and Lorna have raised. First, I would say that data protection authorities have actually been dealing with questions of how to use health, or how various entities, whether public authorities or private sector entities, can use health data appropriately and with respect to privacy. It's always, I wouldn't, certainly we don't want to have any rights trampled, but I think that the GDPR certainly recognizes, and other privacy frameworks do recognize, that privacy is not an absolute right, that it has to be balanced against other rights, including the right to life, which is certainly at stake here very vividly in the context of COVID-19. And data protection authorities have been thinking about these balances for many, many years. I remember being at a conference a few years ago with the CNIL, the French Data Protection Authority, who noted that an entity came to them, they had, or I think a research body, they had the personal data of, I think, 5 million French citizens or residents related to cancer study. They wanted to reuse the data for a related but different purpose. And they asked the CNIL if they needed to reconsent those individuals. And the CNIL recognized that given the importance of doing this research and the burden and challenge of going back and reconsenting all those individuals, that instead they should go ahead and proceed with the reuse of that data for the purpose that they had outlined. So that is one of many, many examples where data protection authorities have been thinking through these issues, certainly not potentially at the same speed and velocity of the issues that we're seeing arise now, but there is nothing new under the sun when it comes to use of data for health purposes. Martin, with respect to your question, I will not opine on the technical aspects, although from the Web Foundation perspective, of course, we're always ready to help advocate for the appropriate use of data and collaboration across borders. One thing I will note again is I would point you to the European Data Protection Board's recent responses to various letters they've received. I think they published on Friday, where they talked about using the international data transfer provisions of the GDPR to ensure that data that is collected and processed in the EU can be transferred out of the EU to be shared with researchers and scientists elsewhere around the world. So there are, again, legal and policy frameworks in place to facilitate the sharing of data. When it comes to those technical solutions, I think we should probably take those offline. I'm not a technical expert, but certainly happy to help advocate for the collaboration around data for health purposes.
Fantastic. Okay, and then I want to come to Charles, who's put in a question just around international cooperation on regulation. And I guess it might be interesting to get a perspective afterwards from Eitan as someone who's tried to push an innovative product, and then Darren as a legislator. But Charles, let's see if we can. There we go. You should be able to talk.
Yes, thank you, Chris, and thank you for a very insightful conversation. I mean, I think it follows actually follows quite neatly from Martin's question and what Emily was just saying. But I think this is a question which I think we've all been grappling with for some time. It's we've got some great pieces of legislation like GDPR, which has been sort of in parts copied for CCPA in California and others, but we're seeing a splinternet rather than an internet as Tim Berners-Lee envisaged happen at the moment. And I just wonder whether to rather than repeat the previous question in its entirety, but I wonder whether this is an opportunity for regulators to come together and collaborate and accelerate something which to achieve a global platform we need, and whether this sort of crisis is actually the catalyst for that sort of change.
Thank you. Eitan, your thoughts as someone who has been on the other end of the regulation?
Yeah, Charles, I thank you for this question. I think you're absolutely right. This is the right time to come together, create a network, and allow on the human level sharing of the anxiety of how can we sort of authorize for a temporary basis some regulations that are not really what we want to see in a normal democratic regular day-to-day life. This is a very special situation. Corona is hitting us at some places, and I think that digital networks should now serve as a catalyst for this. I just want to say that when we finalized our first stage and published our code and designs in open source code, we said, okay, what's the next bottleneck? And we knew that the next bottleneck is the regulators, not because they want to stop things, but because they have to slow down and see what's going on. So we established a network in all 40 countries of people who are advocates or professionals who are used to submit medical devices to the local regulators. We generated a network of all of them and said, let's start sharing. Let's see if the FDA is squeezing a little bit in here or have a fast track there at the CE level. Let's help the regulators help themselves. So we came together as a network to help the network that we didn't see really existing, but we understand that this network exists because the Israeli guy, the Israeli regulator says, do you have anything from the FDA? Do you have anything from the CE? Do you have anything from the Italian? So if you're all reading one another's perspective on a device, you know, maybe this is the time for you to move on. I want to say that it's a true opportunity for them to do that, and they should.
Yeah. And Darren, as a legislator and as somebody who, thinks and tries to build these connections across national borders, how do you feel about, this question of cooperation? Are you optimistic? Is the crisis maybe a moment where countries can come together again, or do you think that's too tall an order?
Well, I'm always optimistic, but I'm not. In this situation, there's a macro problem, right? Which, the international response to the pandemic in itself was very different to international responses to crises in the past, whether they were public health or economic. Many of us called out the fact that G7 or G20 or the United States approach or even the British approach in the early stages wasn't particularly internationalist in the way that we expect these things to be done. And there's a concern that because of the free movement restrictions and around vaccine manufacturing capacity or whatever it might be, that it's creating a tone about a kind of more national approach to work in the future, which is something that for people who support the idea of globalism as I do, is a risk. From the legislator's perspective, though, there is a positive story, which is that whether it's on select committees when we're trying to talk to experts or legislators from different countries to understand why they've taken particular decisions, or whether it's me trying to talk to other legislators like me, which is something I do through a group called the Institute of AI, which is a global network for legislators, it's actually been easier to talk to people because we're now all on Zoom every day. And so it's actually, apart from the time zone, which means you might have to get up a little early or a little late, actually these conversations are happening more frequently now than they did in the past, where, for example, we were trying to get everybody's diary free to bring them to the OECD meeting in Paris, which is a very good meeting, but that can only really happen once or twice a year. So there are some positives around the technology having a positive impact around global networks, but the politics, there's a bit of a risk around that, and we've got to advocate for it in the future.
Fantastic. I like to end on an optimistic note, and we are unfortunately pretty much against the clock. So I think we will pull the conversation to a close there. It's been really, really interesting and illuminating for me, certainly, and hopefully for everybody else who's been following along. And I think we haven't necessarily solved all the problems, but I feel like we've done a good job of exploring and highlighting some of the challenges. I want to thank Tina and Emily and Darren and Eitan for taking the time to be with us and for contributing your perspectives. Thanks to everybody who has been with us both in the Zoom and on the live stream. And if you've got thoughts and feedback on the session or want to pick up on some of the points raised, then you can find us via the website or on Twitter. For now, I will say thank you very much. I hope everybody has a great day, and thanks for joining. Bye-bye.